I'm going to go ahead and get started with our presentation here today. Before I leave the housekeeping slide, I just want to point out to you, you have entered the webinar in auto mute mode, so there is no way to directly communicate with me during the session. However, if you notice the diagram, there is a raise hand icon available to you on your control panel. At the end of the presentation, there will be time for questions and answers if you have any. So feel free to save those questions during the session. I also do want to point out to you that I'm recording today's session. There's been a few changes to the presentation from what is already available on our Resource Center in recorded format, so I am going to be refreshing that with today's recording. So today's session is the Denali upgrade for electronic medical records, and this is the first session. There's actually a total of 5 sessions for our upgrade, 2 of those for electronic medical records, which is your clinical side, 2 of those for practice management, which is the billing side, and then a 5th session that deals with our portals and mobile applications. What we're looking at today in part 1 of the electronic medical record is going to be at a system level on the clinic side. There's some broad changes such as to nomenclature and some user interface changes as far as the aesthetics, labeling, and graphics, but there's also some functional changes that we are going to take a look at today and some new features. I want to mention as far as the second session, it is devoted entirely to orders management. The biggest feature of our upgrade into the Denali version is the order sheet, which composes your orders of varying types, and the entire second session is devoted to that. Now, we will look at a couple of things today that are related to the orders management change because there are other changes throughout the system that are tied into that, but we are not going to look at the specific orders management feature itself today. So getting started, we're going to look at some general changes to the user interface. Now, this is just the screen when you log into the system. There's going to be some label changes, and in the case of our home page, there's some reassortment or realignment of the columns. Now, when you log into the system, you do initially open to the appointment tab of your home page, which is what we're looking at here. And then there's the open encounter tab. So you're able to toggle back and forth between a static day's appointments versus the accumulation of open encounters. Well, the changes are twofold. One, we have brought the columns into the same alignment. So when you are toggling between the appointment and open encounter tab, you're going to see on the left-hand side your appointment level details, such as the scheduled time of the appointment, the time the patient actually arrived, the patient's name, the reason for the visit. In the middle of the screen, what you see outlined in yellow here is new to the Denali upgrade as far as the appointment tab, and that will be your encounter type. Now, if we notice here on the open encounter tab, your visit type is already there. So it's always been present on the open encounter tab, but on the appointment tab, it was part of the tooltip, which required you to hover over the patient name to get the detail. So we have brought it out as a static column now. And then starting with that encounter type, moving to the right, are your routing details during the visit as far as what is going on with that patient within the context of that encounter. So again, that alignment is now consistent on both tabs. The other change, just in the way of the label, is the term status is now visit status. That is because throughout prognosis, there are various things that have a status associated. Specifically here, we're dealing with the patient's routing within their visit, so it is now going to be called visit status, which is what it is also called on the billing side. So that way, if you use our billing system, there's now consistency with this value on your home page. So those are just label and graphical changes. There's no logic change there. Within the visit status, however, there is another nomenclature change. In your existing version, you have a status that says for nurse or with RN. That term nurse has now been relaxed and is going to display as clinical staff. When prognosis first began 15 years ago, the term nurse was hard-coded. But nowadays, a lot of folks don't even have nurses in their practice, or they have varying levels of technicians and clinicians, and they need the same permissions on their user profile. So you're going to create your user still as a clinical staff, but now the term will correctly say clinical staff instead of showing as nurse. That way, if it is a different type of clinician that is attending to the patient, you're not going to be confused on the status. Now moving off of the home page and going into the realm of the scheduling. These are also just graphical changes, not logical changes. Number one, you'll notice on the upper screenshot here, the rewind arrow is for your appointment history. That is replacing the current button that has the label history on it. You see the comparison here in the lower section. Outlined in pink, you have the button that says history, and here in the upper right, indicated by the number 1 on the slide, is the rewind button. Now that rewind button already exists in other places within Prognosis to open up the patient's appointment history. And that is still what that is going to do here on the new appointment pop-up. Also a label change. If you notice, again, outlined in pink in your current version, there's a button with the label cancel. That has been relabeled close, which is exactly what the functionality of that button does. This is a label change only because when it said cancel, it would be a little misleading, and some folks thought that that was how they were canceling the appointment, when in fact you're only canceling what you've done on that window since you opened it. So it's undoing any changes you made and closing the window, but it's still keeping that appointment scheduled. It's not canceling it. So that is why we've made that label change. Now another change, if you're interested, especially if you have multiple locations in your practice, on the schedule page itself, you have a property that is referenced there at the bottom of the slide where you can set what label you want to display on your schedule and an available time slot. Now this is based on the doctor work patterns. When you have scheduled a doctor's availability at each of your locations, every clinic location where you treat patients has a long name and a brief name. You got a couple of snapshots here on the right-hand side of my slide showing that. You've got the long name On the Bay Internal Medicine, which is abbreviated as On Bay Clinic. You've got Bayside Medical Center, the brief name simply being Bayside. And a lot of clients will have their own internal abbreviations or nomenclature for their locations that they use as the brief name, but especially when you have our billing module, the legal name that you do business as also has to be present. Well, the change now with the Denali upgrade in that property referenced at the bottom is you can now have either definition displayed on your schedule. Until now, you could only display the legal name, or there's other options there as well, such as encounter type and things like that. But you didn't have the option of your brief name or the locally abbreviated name. So that is now an option that you can have displayed there if you like by modifying that property. Now moving out of the schedule into patient register, some labeling changes. Under your patient tab, the option guarantor, that is a label change only. In the current version, it says responsible person. Again, this is bringing it into consistency with those of you who use our billing side, where it is already referred to as guarantor. This is not a logic change. It is a label change only. Also there on the billing info tab, if you see the number 1 on my slide, it also has been changed there as the label for the guarantor. Above the patient's photograph, the alert icon now has color coding, so that when it is populated, it will have that bright orange color, and you will be able to visually see at a glance that there are notes present. Also on the billing info tab, now this would be applicable only if you do have practice management enabled with Prognosis. If you use an outside billing service, this function will not be available for you. But for our internal users of billing, there is now a hyperlink to the patient's current statement. This way, folks working the front desk in EMR, if they get questioned by a patient during the visit about their bill, they will be able to open up that statement and discuss it with the patient without having to toggle over to the billing module, without having to have special permissions. This will be available to you as an EMR user with access to patient register. It's just going to be a hyperlink that opens up the current statement. Also with regards to patient register, if you are getting to it through one of the shortcuts, whether it is the hyperlink on your schedule page or if it is the icon on your home page, these two choices open your patient demographic details in a pop-up, as opposed to opening full screen, which is what happens when you go under the menu tab, patient, and select register. Well, when you do it through the menu tab and it's full screen, you have a whole row of icons above the photograph. When you do it through a pop-up, however, you only have access to a couple of icons. Excuse me, and you see the comparison here on my slide. In your current version, you only have case management and patient portal login. With the Denali upgrade, you're also now going to have the insurance icon present, the umbrella. This way, if you are trying to modify demographics through a pop-up, either through that icon on the home page or through the hyperlink on your schedule, you will be able to do both demographics and insurance all at the same time. Another new feature is for you to predefine patient alert phrases. Now, when you use the pop-up alerts that automatically open when you're opening a patient's name and you define those alerts, sometimes they're repetitive and you want the same type of alert present for different patients. So instead of always having to free type it, you now have a binocular which opens a predefined master file. So if you have administrative access to configuration, if you look there at the bottom, there is a group type called PP, Patient Alert Phrases, where you can define up to 140 characters of a phrase that can then be selected through the alert icon so that you don't have to free text it every time. So that's your scheduling and demographic level and home page. It was most of it being aesthetic with regards to label and nomenclature, aside from a couple of new functions there. Now we're going to move to the features at the encounter screen level. First of all, here there's also some label changes. When you are on your table of content menu along the left-hand margin, you have an option called Encounter that opens a sub-menu of Start New and Edit Existing. Now, some of you may use this, some of you may not, depending on your specialty and whether or not you use our scheduling module. These changes are intended for those clients who use these screens apart from the scheduling module. For instance, urgent care and walk-in clinics that don't schedule. This allows them to create an encounter without an appointment and then modify those details if needed. Now, even if you use scheduling, you're still able to come in here and modify if needed. So what we've done is brought these two screens into consistency as well. So that hand-eye coordination, the labels are going to be the same top to bottom. The nomenclature is going to be the same. A slight label change there. Instead of referred by doctor, it now says referred by provider because it may not have been a doctor that referred your patient. And on the Start New, you now, or on the Edit Existing rather, you now have the reason field also. That reason is, of course, your chief reason for the visit, which translates over to your HPI screen as the patient's chief complaint for that visit. You can add it new both in your existing version as well as in Denali. You'll notice both of these screens have that reason field. However, in your existing version, you were not able to modify it. So now we've added the reason there also. So if you do need to modify it, you have that ability. Other changes there on your table of content menu. If you notice on the left-hand margin, outlined in blue, we have a single option called Lab and a single option called Radiology that opens a sub-menu. Now on the far right, outlined in pink, on your existing encounter screen, both Lab and Radiology have two separate options, one called Order, one called Result. And the Result option has a sub-menu which allows you to either look at structured data or matrix, which would be your graph or your historical view of the results. Now, with the condensation here, or the condensing here down to a single menu option, you do not lose any functionality. So as you see here in the middle, you still have a sub-menu and you still have all three choices available, Order, Result, and Matrix. But instead of having a single option called Lab Order and then another separate option called Lab Result with a submenu. It's simply Lab or Radiology with the submenu. And then we've added a new option called Procedure Order. Now that is one of the choices that I mentioned. We're not really going to discuss a lot of detail here today because it is part of the orders management upgrade. But when you are ordering procedures through the new orders management module, there is a new option here that displays that for you. And this gives you options, as we talk about in our second session, about having a procedure checklist, having results coming back when you have sent the patient out for a procedure, and now you're getting results from that outside provider. You have the option of creating new orders within this screen if you're using that workflow in your office. So this will be a new menu option available to you called Procedure Order. And it can be taken off if you choose not to use it. Now going to your template choices. Again, on that left-hand margin, typically you would go from vitals, history of present illness, review of system, physical, and then specialty. Those are your 5 primary categories of input templates. That's what we're going to look at here over the next 3 slides. So first of all, vitals, review of systems, and physical. These 3 have the same changes. So, and you see here in comparison, the one underneath outlined in pink is what you currently have. The one on top outlined in blue is the new Denali version. So we have vitals on the top, review of systems in the middle, physical exam on the bottom. And if you just visually look there, you notice in your current version, you have those great big gray bubbles in the middle, or buttons in the middle, number 1, number 2, and number 3. The functionalities retained. They've just been condensed over to the right-hand margin and shrunk down to little icons. So instead of the big gray bubble labeled 1, 2, 3, you have little blue icons now labeled 1, 2, 3. Performs the same functionality if you use grids. And if you don't use grids, then those buttons will continue to be disabled. The history button is still there where relevant, such as on your vital signs, where it opens up the patient's vitals history. It's not there for review of systems or physical exam. The copy button is now turned into an icon as well. So instead of a gray button that says copy, all 3 of them, you'll notice on the far right margin, is a new icon that looks like an image of paper being photocopied. So functionality fully retained. It's just a new presentation as far as shrinking the buttons down to icons. All of that applies to HPI, but then there's an additional new icon available to HPI, the capital H. And that is going to open in a pop-up the patient's past medical history diagnoses as displayed on their face sheet. So in conjunction with your HPI, if you want to see what the patient's past medical diagnoses are, and you maybe don't remember, or you don't want to stop what you're doing and go back and look at the face sheet, you can now click this new H icon and it will open the past medical history section of your face sheet in a pop-up. And all of that is applicable to specialty, but on specialty we also have 3 additional new icons added. Now this happens to have previously been released, if you notice the green bubble here. So you are probably already used to seeing these buttons, but they came out in a patch and we were not doing an upgrade, so we're just kind of taking advantage now of reintroducing these features if you haven't already explored them and figured them out. So those top 2 bullet points we just covered up above, as far as the copy button being turned into an icon, the grid buttons being turned into icons. The H we just talked about under HPI gives you a pop-up of past medical history from the face sheet. While here at the specialty level, these 3 additional new icons give you additional functionality. All 3 of these icons open pop-ups, and those pop-ups are opened while you're still doing what you're doing in the background on your specialty template. So you don't have to leave your screen. That's the big benefit. The first one is a default face sheet. Now, the face sheet that opens is going to be based upon whether or not you use custom face sheets in your practice. The icon label, if you hover your mouse over, calls it default face sheet. Now, our system itself has a default face sheet that is available on every encounter. And that's the standard face sheet that you see with the 9 squares, current medications, allergies, past medical history, social history, and so on. That may be the face sheet that is opened in this icon, or it may not be. Because when you implement custom face sheets, there are parameters that allow you to define those to be the default based on encounter type, based on doctor, based on gender of the patient, and so on. So when this icon says opens default face sheet, it's going to be the default face sheet for that encounter. In other words, you may click this icon on John Smith and get a different face sheet than when you click the same icon on Mary Smith. But in any event, it does open a face sheet that goes with that visit. The next new icon opens a doctor form. So if in conjunction with this specialty template, you also need to complete a doctor form to go along with it, you can have it pop up right there at the same time and complete them both at once. And then there's also an icon to open your document list. So if you want to quickly review something else on the patient's document list without stopping what you're doing, you can click that document list icon as well. So these are all new pop-up features available to you in conjunction with doing a specialty procedure template. Now the next new change, here at the top, we're including this screenshot of your workflow arrows for discussion only. This itself is not new to Denali. You currently have these green arrows. You may not be using them in your office, but you may be using them. Well, the change that we're introducing now with Denali is to take that workflow, which auto saves information without giving you a pop-up, and extending it outside of your workflow. So if you have chosen not to use the user workflow sequencing of screens, and you just bounce on your table of content menu going from one option to the other, in your existing version, you often will get a pop-up asking you, do you want to save your changes? Changes have been made but not saved. And a lot of people get tired of pop-ups. Sometimes pop-ups are valid, sometimes they can be annoying. So you now have an option. Instead of always getting that pop-up when you're outside of workflow, there's a property that allows you to define a rule. This rule gives you 3 choices: confirm, ignore, or auto-save. In the case of confirming, you will still get a pop-up, as you do now. If you have made changes and you go to choose a different screen without clicking save, you will get a pop-up asking you, do you want to save those changes? You can set that rule to ignore or auto-save. Neither of those cases will you get a pop-up. And the difference is, if you set this rule to ignore, it is never going to save anything unless you explicitly click the save button. So if you started making changes, forget to click save. You're not going to get a pop-up either warning you, so you'll just lose those changes. If you say auto-save, however, it will automatically save what you did, whether it's right or wrong. And again, there will be no pop-up giving you a choice to decide, do I want to save it or not? So this now gives you a choice at the practice level which option you prefer. If you are using that workflow, those green arrows, we've now added document list as an option. So if you need to have the document list open up within your screen sequencing of a specific user workflow, that is now available. Back on your face sheet, if you do health maintenance in your practice, we have added the phrase master and the notes field. So similar to your other face sheet squares where you had allergy notes, medication notes, past medical history notes, and so on, you can now have notes for health maintenance, and you can predefine values in the new phrase master that goes under the binocular. There's also a corresponding output tag to put those notes on your progress note or on any other report that you need them. Within the vaccinations module of your face sheet, if you do vaccines, there are new tags available to distinguish required from recommended. Now there's also properties to distinguish these. You've always had the required property, but now there's a new property for recommended so that you can distinguish them. So if you go into these master files and program which vaccines are required, which are recommended, and then you also want them broken out accordingly on your shot records, you can do that through these new tags. Now looking at your document list, there's several things here to talk about at the document list level. Document list is typically going to be your topmost option on your encounter table of content on the left, although since that is customizable within your practice, it may not be the top option. But wherever it is on your table of content menu, when you hover over and you get your submenu pop up, there's now two new choices available, consult and procedure. These go along with the new orders management that we cover in our second session. When you choose either of those options, consult or procedure, it's going to filter your document list accordingly, and it depends on the status of that order as to which document it's going to filter to. Because you could have it as an order, meaning results haven't come in yet, or if you've started getting results from the outside agency to where you referred the patient, then it's going to be in a result status. So on this menu choice, you can say consult or procedure, and it's going to filter to both orders and or results based upon the status of the individual orders. Now again, this is only if you're using the new order sheet. If you're not using the new order sheet, then these values are not going to be applicable to you. Going along with that, we've also added these choices to your scan and attach screen. So when you do have incoming faxes or you're scanning documents that belong to a procedure order or a consult order, you can now identify those as a consult response or a procedure result. Also on your document list, we have now added pagination. This is a technical feature. It provides you greater screen efficiency when you're loading your document list, especially those of you who have patients that have been a patient for many years, and their document list may have several hundred documents on it. So every time you go in there, the screen load time, when you go to open a document or scroll up and down, it may take nanoseconds, but those nanoseconds add up. So by hyperlinking it now into segments of 25, you'll notice a greater speed efficiency and load time. So every time you add that 26th document, you will get a new page hyperlink incremented there. Now the sorting is still exactly as it is today, with the most recent on top, the oldest on the bottom. And when you scroll within your document list viewing area, it's going to scroll 25 documents at a time. Then you will have to go to the next page number. Another new feature here at the document list level is a new icon called Share on Portal. Now this, of course, is only going to be relevant if you have any of the portals activated within your practice. Prognosis now offers 3 portals as of the Denali version. We have Patient Portal, we have Referring Doctor Portal, and we have the new Employer Portal. Every document that is applicable for being shared can be shared. But in order for you to do that, which means make it visible on the portal, you have to have this user role assigned to your user profile in Prognosis. The role is indicated for you here at the bottom of the slide. So each individual user within your practice that needs this functionality, this icon will be enabled for you. Otherwise, if you don't have that user role, the icon will be displayed on the screen, but it'll be grayed out and you won't be able to do anything with it. If you have the user role, when you click that icon, you will get a pop-up. That pop-up is either going to be like the one you see here on the bottom that says not applicable for sharing, or like the one you see on top where you will have an on-off switch. And the choices here of the 3 portals will be based upon your practice and which portals you're using. And you simply say on or off if you want that document to be visible for users who log into that respective portal. Now in the case of the lower one here, when it says not applicable, that means one of 2 things. And the conditions are in the appendix a little bit down below here. Not applicable means either 1, the document is never shareable. Like within EMR, if you have messages to one another, those cannot be shared on the portal. Or it may mean conditions are not yet satisfied because there's properties that you define when you let results be available on the portal for doctors or patients to look at. If the progress note, if the encounter is not closed yet, the progress note is not committed to history and cannot be viewed yet. So that would be a condition. Now when you are going to share it, once you click that on or off switch, then this new column called portals with these little letters will, by color coding, let you know whether that document is shared or not. Now the capital letter represents the portal. P for patient portal, R for referring doctor portal, E for employer portal. The color coding represents whether or not that document is visible on that portal. So if it is a white letter in a gray circle, that document is not visible on the portal. It has not been shared. If it is a yellow letter in a blue circle, that means it is shared on that particular portal. And as you see in the screenshot here, it doesn't have to be shared on all three. It doesn't have to be shared on any, or it can be shared on all three. So that all depends on whoever within your practice has that permission and what your workflows are, and if you're going to make these things visible or not on the portal. You then have the option within your filtering to filter based on the shared status of your document. And this is the appendix that lists the conditions as to whether or not a document can be shared and if there's conditions associated before you can share it. And that's the difference between the on-off pop-up or the not applicable pop-up that we saw up above. So that is all encounter level functionality as regards your table of content maneuvering, document list specifics. Now specifically to your assessment level, a couple of new features that impact assessment data. One, the government, non-government charge validation. Now many of you have the billing system, and this is incorporated into the billing system as you see in the blue bubble through crossover codes or scrubber checks, and your biller worries about it. So on the EMR side, it's not a factor. That is still the default logic. So just because this feature is being introduced doesn't mean you have to change your workflow. Many clients, however, want the values done clinically as opposed to waiting for the biller to do it because they want the assessment on the progress note to match the claim that goes out the door. So it's a matter of preference as to how the doctor runs his business. Also, if you have an outside billing service instead of prognosis, they may need to be informed so that they put the appropriate code on the bill. So if you choose to implement this at the point of EMR, it can be done either at the encounter type level or at the claim filing code level. Now the enhancement here with the Denali upgrade is number one, making it default at the insurance claim filing code. Number two is already present in your system. Many clients have opted not to use it at the encounter type level because they might have an encounter type for new patient, for follow-up patient, for surgical patient, and it doesn't matter who the insurance is. And they didn't want to create a bunch of different encounter types. So they opted not to implement it at the clinical level, and that's when they do the crossovers on the billing side. So that again is a matter of choice. But by putting it to the insurance level now, it gives you a little more control, and you can have more specific encounter types without having to duplicate them for government or non-government. And basically what this is if you're in the situation where you are rendering a procedure and your government payers want the CPT code or HCPC to be one, whereas commercial payers want it to be another. As you see in the example, government wants G0479 for the exact same service that non-government wants 80304. So by doing it here at the EMR level on your assessment screen, that means your assessment will be reflective exactly how your bill is, and the biller does not have to do anything to fix it. It'll be automatic, and it'll be the same both in EMR and billing. If you don't want to do it in EMR, again, that's completely fine. You don't have to. You can still put whatever procedure code you need to off of the template, and then the biller can still change it on the claim. Now, another change with the Denali upgrade that has been added to the assessment level is Autocopy. If you notice here at the bottom, outlined in pink, currently this is at a system level, and it is an all or none for everybody in your practice. Now we've taken it away from a system level and put it at a specialty level. So for those of you who have multi-specialty practices and you want to take benefit of the Autocopy, which means bring forward from my last encounter all of this information, you can now do that based on the specialty of the attending doctor. So if the patient saw the OBGYN last week, but a month ago they saw family practice, and now today they're coming back in specifically for family practice, it will autocopy from a month ago the family practice instead of autocopying last week's GYN visit, because it's going to look at the specialty of the attending doctor. Another feature added now to EMR that until now has only existed in billing, very similar to that conversation we just had with the government, non-government coding, is with regards to scrubber checks, which will let you know in advance whether or not the combination of charges are going to be billable. So this again is a matter of preference. If your doctor/office administrator wants things handled up front at the clinical level so that the biller has less to do and it mirrors exactly the same in both systems, or if you don't want it to be stopped here on the clinical side, you want the biller to worry about it, then you don't need to turn these on. Scrubber checks already exist in billing. What we're doing now is bringing them up to the EMR level for those clients who do want it up front. So a scrubber check basically is going to look at what you've defined based on the equation you've defined and give you a pop-up that tells you whether or not that's wrong and whether or not you need to change something. So in the example we're looking at here, we have added a CPT code for office visit established, but also office visit new. Well, obviously a patient cannot be both new and established at the same time on the same visit. So you would not want this to go to billing. So by bringing the scrubber check up front to EMR, it's not even going to let the doctor close the encounter until he corrects it by removing the wrong one. Because at the point of visit is where you're going to know, is this an established patient? Is this a new patient? So the scrubber check master, if you do already have billing and you're familiar with this feature, it's exactly the same in EMR. If you've never seen it before, or if you're EMR only, what this screen is allowing you to build basically a mathematical equation, to be honest. You may have thought that you left behind algebra 20 years ago when you left middle school. Well, bring it back to 4 now if you're going to build these validations, because that's basically what you're doing under number 1, the setup button. Number 2 here is where you decide whether it's going to be a warning or an error. Warning is going to bring a pop-up, but the user can ignore it and still save it whether it's right or wrong. Error will force the user to fix it, or they will not be able to save the assessment. And this is where you're building that mathematical expression. When you go into the setup button, it's just a series of drop-downs. You have 3 choices. The operand is your data element. Do you want it to start by looking at the CPT code, the ICD code, a modifier, the insurance, the doctor's NPI number, whatever piece of data you want to validate is your operand. The operator is then the action that needs to be applied. Do you want it to be equal to? Do you want it to be greater than or less than? And then the value. What do you want to be the condition that is validated? Do you want the CPT code to be equal to? Do you want it to be something else? And so on and so forth. So that pop-up that we just showed you, this is the design of it. You say operand assessment CPT code equal to 99201, and the fact that we went to number 2 and added another line assumes both conditions have to be met in order for this pop-up to work. Assessment CPT code equal to 99211. So this scrubber check will only pop up when you have both of those codes present on the same assessment. That's when you will get the pop-up. And because back here I indicated I wanted it to be an error, that means the doctor or whomever must fix it, or he will not be able to save the assessment. And the fixing is what you put here in the error message. Remove one. It's that simple. You cannot have both new and established on the same patient, so remove whichever one is incorrect. As soon as you remove one of those CPT codes, this scrubber check no longer applies because now it only reads one. It doesn't read both of them. So this is just a simple example of a scrubber check. You obviously can build more complicated ones if you need to. And again, this is strictly optional. If you notice here at the bottom, there is a new property that governs this. If that property is not turned on, you're not going to have the master file where you do the setup. So if this is a feature you want, you can contact technical support unless you have the administrator level access to turn that property on. Once the property is enabled, then you will have this master file where you can build the setup. This is also available on your doctor form if you use a doctor form to do diagnosis and CPT code on your assessment. So this is all relevant only to the assessment screen. It's just a matter of if you do the assessment manually directly in assessment or if you enter it through a doctor form. Another encounter level functionality part of Denali is autocopy prescription details from the last encounter. Now this is an exact autocopy from the last non-zero duration encounter, meaning the last live visit that the patient had in your office. If there was a prescription, it will autocopy completely. Dosage, strength, frequency, dispense quantity, etc. Now, of course, you can change it if you want to at that level. This is in addition to, or instead of, rather, your existing prescription logic. So this, again, is something you do not have to turn on unless you want it. It's very specific in that, let's say you do medication management. For instance, I'm aware of a doctor that went live who 70% of his practice is medication management, and these patients have 20, 30 prescriptions. He's managing because he's a family practice, and he's managing all of their meds for them. And they just simply come in every 3 months for refills. It might be 10 drugs, it might be 20, it might be 30. And so this auto copies that prescription automatically when that patient's marked arrived. So all he has to do is complete the prescription. He doesn't have to choose the 20 and 30 drugs out of the patient's history. So that's the functionality. If you want to turn it on, the property's listed for you there at the bottom. If you don't use it, all of your existing prescription logic still applies as far as looking at the doctor and the patient and the drug to bring forward the details. Also at the prescription level, when you're e-prescribing, if there are multiple errors, they will now all display at one time in a single pop-up, so you can fix them all at once, instead of fixing one error just to go back and try to write a prescription and get another. On the encounter close, there's been two new lines added in your table for consults and procedures. This again ties into the new orders management. So basically, one of the changes system-wide, wherever orders are referenced, has been modified to now accommodate the new order sheet. So in addition to lab and radiology, we now have consults and procedures added. Same thing with the number 2 on the bullet point. If you decide to use the order sheet, there's a property that gives you an option that forces the orders to be completed before the doctor can close the encounter. So that property has also been modified to incorporate consults and procedures besides lab, radiology, and prescriptions. Now moving out of the encounter and looking at other EMR level upgrade features. Patient letters out, excuse me. In the upper left of your letters out screen, where you have a drop down of entities associated with your patient. That has been modified now to include 47 different values. What we've done now due to case management and employer billing workflows, there's a lot new values up there such as employer, adjusters, attorneys, things like that. So there's a lot of additional choices available to you now. The aesthetic labeling of your clinic form Couple of changes here to bring it into consistency with other screens in the system. If you notice here on the left-hand side, outlined in blue for the new Denali, we've added the binocular master search if you need to change your patient. Whereas down here in the lower right, outlined in pink, instead of the binocular, you see the label name is hyperlinked. Confuse some people because normally when you go in to choose a patient, you have a binocular search. We've also added the umbrella for patient insurance instead of that being a hyperlink. So this is the same functionality, just being presented to you a little differently. Another major change is your reports user interface. When you go in to order reports, it is now a single screen. Within this single screen, you can choose your report query, apply your date range, select your filters, generate the output. In your existing version, that is accomplished through 3 separate screens. So you first choose your query, and a second pop-up, you define your date parameters, and a third window, you get the results. And if you then want to refresh the data, run it on a different date period or something, you have to go through the same 3 screens again. So by consolidating it onto a single screen, you get a greater efficiency. And you can refresh your data in real time right there on the same window. Now across the top, those first 3 fields allow you to define a personal reports catalog. That is an existing feature, but in case you were not aware, you do have the option of classifying reports. Maybe you identify this is end of month, this is user productivity, or maybe you want to call it collection-wise, charge-wise, however you do your business. You know, when you get your prognosis system, there are several hundred reports by default. And so it might be a little daunting to decide, well, what report do I run? So once you identify those, remember you do have the ability of classifying them and saving them into a personal catalog so that it's easier to find in the future. And then that becomes your default when you come in here to order a report. Now in my screen example, if you notice behind my number 1 and my number 2, I'm defaulting to all. So obviously you're going to have a greater search to go through to get the report you want. But if you've chosen to define them as personal reports at a user level, each user can have a personal reports catalog, then that would become your default. Whatever report you've chosen then, you have these different filters or parameters that you can apply. If you want to freeze columns, for instance, number 4, if you're used to using, if you've ever used Microsoft Excel and you have a large number of columns of data scrolling horizontally and you want to lock like the patient's name or the account number or something, you can do that by specifying how many columns you want to freeze. You can, of course, specify a different date parameter or number of days. If you just want to say 120, instead of counting backwards, what date of the calendar that would start with. Number 6, in this example, it's grayed out because I've chosen a report that does not have any additional criteria. But if it's a report that is based on specific criteria, such as encounter type, insurance company, financial code, then this field would be enabled and you would be able to choose that value through the binocular search. And again, all of this stays static on your screen now, so if you need to change any of these parameters, you do it in real time and get the results immediately down below. Most importantly here would be these other choices now. Hide identifier, for instance. Maybe you're doing an analysis locally at your desk. You need the PHI. But then once you've done the analysis and you want to share that data, you want to print the report for external use, you might want to hide the PHI. So then you click the checkbox that says hide identifier, regenerate the report, and the PHI will come out as X's. And of course you can apply filters, sort it the way you want, and so on. So all of that is available now at runtime on the same screen. Same with graphs. We've applied the exact same user interface to graphs. So instead of data, if you're one that likes your graphical output, you've got the same design changes. Instead of separate screens where you choose the query, then apply the dates, it's all in a single window. And then if you, again, have the ability of classifying them if you want, if you then want to change the graph, maybe one doctor in your practice likes a bar graph, maybe the other doctor likes a pie chart. Maybe your billing manager wants a line graph or something. So you can apply the different graph types and refresh your data in real time. And then if you are going to play with those different graphs, in your graph master, and now again, anything under configuration requires permissions, of course, you can define what graphs should default, what labels you want to print on your graph, what colors you want on your graph. And these are the 5 different types available. So we've enhanced the graphs here in EMR to mirror the graphability that we have in billing, for those of you who like graphs. And then that brings us to our system level upgrades. Again, some nomenclature changes, and a lot of this may not even be part of your daily routine. A lot of it is handled when you first become a client of Prognosis and we implement you. But even throughout the life of your, while you're using EMR, as new employees get hired in your practice and you need to create user profiles, then those of you who have the appropriate settings configuration access can come out here under configuration and build your users. So that is when this nomenclature would apply. Until now, the column has been called medics, which kind of indicated it was doctors, but it's actually everybody that needs a user profile. So we've simply changed that to the word users to make it a little easier. And then anywhere in the system where you choose a user, that pick list, that radio button, that master search, the label will now say user instead of medic, because it does not include only medics. It includes all users. So that's a label change only, not logic. Similarly, within the user column, we've renamed admin staff office staff because some levels within your practice may think of an administrator as being IT, somebody who does go into configuration and make changes. However, the user profile admin staff means administrative, not administrator. So it has now been relabeled office staff to clearly define what that level of permission is. And then our menu choices for the attaching and scan have also been modified. We have the attach center, which is external or not direct. And then we have scan local attach, which is immediately attached to your chart in real time. There's 2 new organization masters that are primarily for the new orders management as well as for billing changes. This is when you are having patients referred to you by an organization as opposed to a human doctor. So ambulatory surge centers or hospitals or Diagnostics R Us instead of Dr. Doolittle. You can have those distinguished now from the referring doctor master, which requires a first name, last name configuration. Complaints can now be sequenced. This is for your intake when you go under HPI and you're choosing the patient's complaints for that visit and you do your binocular search. You can now sequence how they appear in that binocular search so that you don't have to type and look for what you're wanting. You know, a lot of doctors will put their top 20, top 50 at the top of the list. If you do template design, some label changes in there in design view. Again, label change only does not affect the logic, just makes it less confusing when you go in there to make a design change. The label face sheet is now called carry forward because it does not display on the face sheet, but it carries the data forward as if it were a face sheet item. And then when you predefine CPTs and HCPCs, it's not necessarily mandatory, but if they're defined under that button, they will by default get billed. As opposed to when you define them as optional, a human has to choose it in order for it to be billed. So those labels are just now being a little more descriptive of what the functionality is. Another beautiful new feature, if you do template design, is the ability of duplicating an entire system of questions to a new system so that you're not independently creating each question multiple times. This is especially advantageous wherever you have questions that are left, right, bilateral, normal, abnormal, you know, digits, first, second, third, fourth, fifth, hand or finger, first, second, third, fourth toe, and so on. So it is a big time saver. As you see in my example, I've created a set of questions called left lower extremity, and now I want to duplicate all 20 for my right, and then I'm going to duplicate them again for bilateral. So instead of recreating 20 questions 3 times, I create them the first time, click this new icon on the system level instead of the test level, and it's going to ask me what I want to name that new organ system. And in this case, I named it right, and then it immediately duplicates all those questions into that new category. Clinic forms configuration. As we discussed in Part 2 webinar, the orders management, you can now have a procedure checklist. Those are designed under clinic forms, so there's a new checkbox indicator there. When you create a clinic form, if you intend on it being a procedure checklist, then you identify it as such, and that makes it available on the orders management for those procedures. When you're importing new tests, maybe you have an Excel spreadsheet from an old system that you've used, or you just find Excel easier to use than Prognosis and you want to have all these new elements to create templates from, you can now import those. Sometimes it's necessary to have a quote-unquote super user. So you have a nurse, but then you might have a super nurse, a nurse manager, who needs to have a little bit of additional permissions. So when you take that base role of permissions, we now have a save as. So you can create it under a new name and then manipulate the permissions accordingly instead of recreating it from scratch. Those of you who have administrator access and can go in and modify properties, the user interface has been redesigned. It's a lot more user-friendly. I don't have a comparison here on this slide, but it used to just be a very scary DOS-looking screen, and it almost made you feel like you had to be a programmer. So now you see a lot of different choices, such as pick list, on-off buttons, multiple choice, color mapping, so it makes it a lot easier for you to define these properties now. And most importantly, amongst those properties, as supported events is now available to you as a user for providers and clinical staff. Previously, this was reserved for our use only. So if you wanted to modify and you had to call our help desk, you can now modify this property on your own if you're a doctor or a clinical user. By going into the supported events property, it's now a master search, meaning you have the binocular. And when you click that binocular, it now opens up what each of those supported events mean, and you simply select it or deselect it. Now, what a supported event is a system-generated alert or message in your Prognosis inbox telling you that something happened. Some of these doctors want. They want to know when a result is posted and whether it's normal or abnormal. They may not want to know, however, when a new patient has been registered, because they're going to see that patient on the day of their visit. So by default, especially if you're a new client, a lot of these alerts are turned on, and when you're just learning EMR, you end up with 1,000 messages and you don't know what to do with them yet. So now you have the ability of going in and disabling those messages if you don't want them coming into your mailbox. Another nice feature that has been added for when a system error occurs. You now have the option when the error happens, and I don't have a comparison again of what it looks like today, but what it looks like today is you get a pop-up that says HTTP error, and then there's a bunch of gibberish. It kind of looks like computer code that you nor I really know what to do with because the engineers do. So now, instead of giving you that, that's all behind the scenes. But this window now pops up and gives you the ability of entering free text what you were doing when this error happened. And that automatically generates a message to the engineer, so you don't have to call the help desk. It will automatically generate a ticket with your comments. I was doing this and this. There's disclaimer details on here. Of course, you don't want to include PHI, but you can refer to the chart number as opposed to the patient name. There's also troubleshooting suggestions there at the top, depending on the error. Maybe it will fix itself if you refresh the page or by logging out and logging back in. So this is a new interactive level of troubleshooting without having to get on the phone to our help desk. And then just system-wide, some miscellaneous choices that are available. There's new validation at the CPT HCPC with regards to state-provided vaccines. They will no longer auto-bill. if you're participating in a state-ran vaccination program. If you have the ability of deleting a CPT or HCPC, and it has been previously referenced, it will no longer allow you to delete it because it needs to be retained for historical accuracy on the audit trail. Drug info sheet, if you provide that to your patients at the medication level, it's now available in a PDF. Decimal point calculations when they're interfaced will no longer truncate at 2. So if you get a result from the lab that's 8 digits out behind the decimal, all 8 digits will now display on your results screen. All master screens are now included in the audit trail when modified by a user. So there's a tracking now whenever somebody goes in and changes something. Clinic ID tag is now available for output or referencing. Every clinic has an ID. So instead of saying your Dr. Doolittle Internal Medicine, your clinic ID 9000. And another reiteration here at the bottom, I've mentioned probably a dozen times, if you do participate in orders, you do want to make sure you attend the second session. If you don't do anything with orders, however, there's no reason for you to attend that session. It is specifically for doctors and nurses, checkout people, medical assistants, whoever processes orders. So what's next with regards to your upgrade? When you are scheduled, if you have not already received the upgrade, once you log into Prognosis, you will get this pop-up 7 days in advance telling you when you're scheduled to be upgraded. So you'll know at least 7 days in advance before you get the upgrade. Once the upgrade's applied, you're going to start to see all these little yellow pop-ups. Wherever there's a change on your screen, a new feature, a new icon, a label change, you're going to have these pop-ups. You have the option of saying hide or don't show me again. If you say don't show me again, it's never going to pop up again. If you say hide, it only hides it for that patient. And the next time you go into that screen on another patient, it's going to pop up again. You also have a shortcut icon at the top of your page labeled New. That gives you direct link to the release notes. What I've just presented by means of 50 or 60 PowerPoint slides is 150 pages of tech notes. So if you are one that likes to read the full technical notes and get more details behind what I've presented in an abbreviated format, then you will have access to those. Even after that new bubble disappears, release notes are always part of the system. You can go into the Life Preserver icon, click on R for release notes, and your EMR stuff is included in the turquoise column. And lastly, please remember the Resource Center is there for your use. I mentioned on the onset that there's a recorded version of this. Actually, later tonight, this particular one will be there because I will be updating it with today's recording. All of the other sessions are also out there already in recorded form. Also, under documentation, you can get a copy of the PowerPoint that we've been looking at. Okay, so that is today's presentation. Are there any questions? If so, if you click that raise hand icon. Okay, I thank you and I wish you all a good day. Thank you.